Hello, everyone. Today's discussion is going to be surrounding teen pregnancy prevention, specifically planning for a childhood and the steps that may need to be taken to maintain a childhood. First, it is key to take note that the United States is ranked highest in industrialized countries that are experiencing these high rates of teen pregnancy. In this statement, it's also very important to kind of understand that other countries and even states within our own country have used preventions and found solutions for these high teenage pregnancy rates. Further, under the umbrella of this topic, multiple studies have been conducted, studies that are specific to portions of the total issue of teen pregnancy, as well as more focused on the long term and how this affects the teenager, the child, and as well society. In one specific study, a longitudinal study that was conducted in 2001, they found that 118 out of 533 females were actually pregnant at least once by the age of 20 years old. That is 22%, which is quite a large amount when looking at this from a larger perspective or a larger scale. So now diving in a little bit deeper, how do we know? What are the risks to teen pregnancy? Once we identify these risks, we can then get into how do we combat them? How do we work to solve this greater issue? So, identifying the risks. We have four key areas that are related to teen pregnancy. We have environmental influences, parental influences, behavioral influences, and social influences. Now, I want to get a little bit deeper into each of these categories, and starting with environmental influences, we have things such as low socioeconomic status. Now, here within this statement alone, there are multiple things to consider. Poverty in itself has been proven to be an issue, specifically what that means, again, on the larger scale and on more long term. So we're talking about perpetual poverty. This also will include things such as the area of residence, where in a specific city is someone living. Employment deprivation. Are the parents of this teenager employed? How long have they been employed? What kind of job do they have? And if they're not employed, kind of what does that situation look like? As well as just overall social norms that are falling within the environment that the teenager is in. Now, when looking into parental influences, this somewhat relates to environmental influences, but you'll start to see things such as intergenerational factors and distant relationships with parents. So what does that interaction between the parent and the teenager look like? How do they parent? And how is that teenager growing up within that household? All of these exposures, whether it be coercive child rearing or sexual abuse, things of that nature, any manipulation that may be taking place, that all affects the teenager and could have negative effects leading to teenage pregnancy. Next, I want to talk about behavioral influences. Now here, this as well can mean a lot of different things, but I wanted to pinpoint four specific things. Ambivalent attitudes towards pregnancy. How does the teenager, and we'll get into a little bit later, their friends feel about pregnancy and sex in general, as well as preventative measures? What is the overall attitude around this topic? As well, how are they behaving in school? How are they performing in school? What's their IQ? All of these, again, have factors and influences to teen pregnancy. Lastly, let's consider the social influences, which we just briefly touched on, but any involvement with deviant peers or peer/partner pressure, that's going to affect the way that the teenager in question is going to feel about pregnancy, sex, as well as any preventative measures. Okay, so here we kind of touched on this as well. Teen pregnancy does not only affect the teen, it affects the teen, it affects the partner of that teen, the child, and then further the parents of that child, the community, and then society as a whole. When considering teenage pregnancy as the outcome of the exposure to these risks that we've just discussed, it is very important that prevention and any intervention programs specifically highlight the importance and necessity of both interventions related to the family as well as related to personal risk factors. Now, here I want to discuss two specific attitudes or perceptions surrounding teen pregnancy prevention, otherwise known as TPP, those being abstinence only and comprehensive sexuality programs. Now, when digging deeper into abstinence only, the focus is really centered on abstinence as the most effective form of contraception. Now, in this perception or this attitude, there is not much discussion, if any discussion, on other or alternative options. As stated, abstinence is the only contraception that is mentioned here. Now, when dealing with comprehensive sexuality programs, it is a broader perspective and a more welcoming perspective in terms of the information that is provided to the student or to the teen. So, focus is placed on the fact that teens have varied attitudes on sex, and more importantly, those attitudes have major effects on their intentions and the behaviors that result from those intentions. So we want to make sure that teens have the information that they need to make informed decisions. So that's introducing them to various forms of contraceptive methods. Now, in this space, there is room for study and analysis on what the climate looks like pre and post intervention. Are the attitudes of these students and of these teens changing? And is it an effective method, or are these effective methods for reducing the risk of teenage pregnancy? Now, on the one hand, as we discussed, we have comprehensive TPP programs, which generally speaking, can improve the attitude towards sexuality and sexual norms. And on the other hand, you have abstinence only programs, which as well have shown potential to strengthen the intentions to remain abstinence. But again, what does this mean on the broader scale? Overall, findings are supporting that these TPP programs and the idea behind them, really, we want to make sure that we're focusing on improving the attitudes about sexual activity, peer norms, and refusal skills. Now, when considering a TPP program for your specific school or institution, you want to make sure that you are considering the factors that make your school unique. What do your faculty and staff numbers look like? How much do you have to support, whether it be monetary funds and or time and staff, to these programs? Now, we have listed 4 programs that have all proven to be successful in their own right. One being Teen Outreach Program with a text messaging component. The second is multi-component community-wide program. The third would be Prime Time, which is a clinic-based approach. And the fourth, Power Through Choices intervention program. Now, looking at the first option mentioned, Teen Outreach Program with a texting component, essentially participants are sent a text message that's going to help promote positive social norms and social development. Now, are a couple of components to consider here, where this specific prevention combines volunteering with the community with classroom talks about life options. So the overall idea here is that we want to make sure that our teens, our students, are developing competence in decision making, specifically while they're interacting with their peers, as well as understanding how they can recognize and manage their emotions. Now, when looking at the multi-component community-wide program, This prevention is focused on 5 key components that all work together to basically target a different aspect of teen pregnancy. Those components being evidence-based interventions, clinical services, community mobilization, stakeholder education, and the inclusion of diverse minority communities. Now, all of these different factors working together is really how this intervention works. Third, we have prime time. Now, prime time is a clinic based prevention, and it may not be ideal for schools that don't have a strong therapeutic component to their curriculum. Now, overall, it is an 18-month long program, and it includes one on one interactions between the student and a case manager. Now, in this space, the idea is to really reduce behaviors that lead to teen pregnancy. So, going back to a few of the risks that we've mentioned with behavioral and social influences, the idea is to kind of hone into those areas and help that student, help the teenager make changes there. Now, the case manager's job is really to foster positive peer relationships as well as enhance skills for school involvement and promote a healthy expectation for relationship and safe sex. Lastly, we have power through choices. This prevention really works to improve the knowledge surrounding HIV and STIs in the long term. So it consists of 10 intervention sessions that are specifically geared towards teens that have been removed or displaced from their home. Now, there is room for some modification for your specific school setting, but the general idea here is that it's going to target a teen's knowledge, attitude, and behavioral intentions regarding sexual activity and contraception methods. Now, in this space where we have not only identified the risks associated with teen pregnancy, but also perceptions of preventions, we know abstinence only, we know a comprehensive program, we know what that looks like. So now the question really is which program is going to be right for your school? As previously mentioned, it's key to consider the unique nature of your school. What resources do you have, whether that be monetary, and or your staff? How much can you dedicate to this program? Again, looking back at the risks and at the importance of this program, it is key that you find the program that's going to work best for your school. Thank you so much for listening.